In other news, an investigation is underway in Cambodia into the possibility of human transmission of H5N1, or the bird flu. It was sparked after an 11-year-old girl in that country died from the disease. Investigators tested the girl's close relatives following her death and discovered that her father was also positive. Authorities are now scrambling to determine how he caught the infection, and if he contracted it from his daughter, well, then that would be a rare case of human-to-human transmission. CBC's Dominic Velitis is following that story for us from London. Dom, what are the authorities saying?
Well, Natasha, they've confirmed that this 11-year-old girl in Prey Veng province did die after being infected with bird flu, and this was the country's first known human infection since 2014. Health officials have been to her home and have since disinfected it. They've also done some testing in the area. 12 people have been tested in all, and one of them, the girl's father, as you say, tested positive. And investigators are trying to establish whether he caught this from his daughter or through contact with an infected bird. Now, news of this young girl's death, the widespread of the virus in birds around the world, and increasing reports of cases in mammals, including humans, has really worried the World Health Organization. Indeed, in response, it's now calling on countries everywhere to be vigilant, to be on the lookout for any mutation of this virus that could see it spreading among humans with relative ease. The good news, Natasha, is that if that does happen, the WHO says a number of things can be done to limit its spread, things like isolating people who've tested positive, giving them antivirals, and identifying others that they've been in contact with. So very similar measures that we're perhaps all used to, similar measures to the ones that were introduced during the COVID pandemic. Natasha.
And the United Kingdom has released details about their contingency plan for bird flu. What do you know about that?
Yeah, that's right. And although there's currently no evidence that bird flu is an imminent threat or can indeed spread between people with ease, health officials here aren't taking any chances. They're erring on the side of caution, and part of the planning is modelling scenarios of human transmission. So they're looking at how many people might become infected and die if we did see human-to-human transmission of bird flu. They're working on two scenarios. The first is a mild scenario where the infection fatality rate is similar to COVID, and then there is the scary second scenario, a severe scenario similar to the 1918 flu pandemic, where far greater numbers of people died. So modelling is underway as part of general planning here in the UK, an approach the infectious diseases specialist, Dr. Isaac Bogosh, would like to see in Canada. Here he is. Take a listen.
What is our plan? And of course, right now we're talking about H5N1, an avian influenza, but we know that there's going to be another pandemic. We know there is going to be another pandemic. The question is, what is the organism going to be, and when is it going to happen? So we obviously need Canadian contingency plans for pandemic preparedness. We also need global contingency plans for pandemic preparedness.
And in addition to their general planning, Natasha, health officials here in the UK are also looking at whether COVID-style mass testing would be helpful in the event of human-to-human transmission, and what genetic mutations in the virus might signal an increased risk to human health. Natasha.
Dominic Velitis in London. Thank you, Dom.
Thank you.